Hello, I am Dr. Kalila Jefferson, DNP. Let me start with the truth that may feel uncomfortable. Just because your employer allows something does not mean it is safe, and it certainly does not mean it protects your license. As advanced practice nurses, nurse practitioners, clinical nurse specialists, and CRNAs, we are highly trained, highly trusted, and highly accountable. But too often, we find ourselves working in systems that prioritize productivity over safety, volume over vigilance, and revenue over responsibility. And when something goes wrong, it's not the organization that stands before the board, it is you, your name, your license, your livelihood. So today, I want to discuss what every advanced practice nurse must understand about standards of care and how to protect yourself when your employer doesn't. First, let's define the standard of care. It is not your clinic policy. It is not what your supervising physician prefers. It is not what we've always done here. The standard of care is what a reasonably prudent provider with similar training would do in the same situation. It is shaped by evidence based practice, clinical guidelines, and professional consensus, which means this: if your workplace cuts corners, you cannot. If your schedule is unsafe, your judgment still matters. If you are asked to practice outside your scope, the responsibility is still yours. And that brings me to the first principle of protecting your license: know your scope and do not cross it. Pressure may come in subtle ways. Can you just sign this? Can you see a few extra patients? Can you handle this case? The doctor is busy. But practicing beyond your scope, even with good intentions, puts your license at risk. Second, document like your license depends on it, because it does. Clear, thorough documentation is your strongest defense. It tells the story of your clinical reasoning, your patient education, and your decision making process. If it's not documented legally, it didn't happen. Third, speak up and put it in writing. If you are placed in unsafe conditions, unsafe staffing, lack of supervision, inadequate training, you must advocate, not just verbally, but in writing. Emails, incident reports, formal concerns. These create a record that you recognize the risk and took action. Fourth, carry your own malpractice insurance, because no matter what you're told, your employer's policy is designed to protect them first. And finally, be willing to say no. No to unsafe assignments. No to unethical practices. No to anything that compromises patient safety or your professional integrity. Saying no can feel risky, but losing your license is far riskier. As advanced practice nurses, we are not just providers. We are professionals bound by ethical duty, clinical standards, and legal accountability. Even in broken systems, we must remain grounded in safe practice. Because at the end of the day, your license is not just a credential, it is your voice, your career, your ability to care for others, and it is worth protecting. Thank you.